cluster headache is also fascinating because, the aspects and also by the severity of disease. It's amazing how much one individual can suffer by the attacks. The anticipatory anxiety. I mean, everything that you experience that is not good, you are afraid of having again. Anything. I think it's making the suffering visible. Is to speak up, is to show up, is to, tell the story.
Hello, everyone. Good morning, good afternoon, good evening, wherever you are listening from. Thanks for tuning in to my Clusters Beyond the Pain podcast. My name is Darshan. I am a cluster headache patient, cluster head, whatever you might like to call it. After suffering a severe bout in 2023, 2024, I started my clusters, a cluster headache intelligence platform with a tracking analysis app for patients and research platform. Very excited to have our guest today. I've heard him over the years speak passionately about many causes, challenges in the cluster headache field. So please join me in welcoming Dr. Mario Perez to the podcast. Quick introduction. Dr. Perez is the founder of the São Paulo Headache Center, and he's the program director of the Headache Medicine Training for Neurology Residence Program at Albert Einstein Hospital in São Paulo. He's also a senior researcher and professor of postgraduation at Psychiatry Institute, São Paulo State University Medical School. Born in São Paulo in 1971, he had his neurology residency training in 1998, PhD in neurology in 2000 at Federal University of São Paulo, his headache fellowship at Jefferson Headache Center from Thomas Jefferson University in 2000-2001. Over the years, Dr. Perez has authored or co-authored more than 300 peer-reviewed publications, book chapters, and a book for headache patients. He has dedicated the past 25 years full-time to the headache field in clinical practice, academic training, public awareness, and research. He also is very active, and I can vouch for this, on increasing awareness towards chronic headaches, cluster headaches, personally on social media with more than 10 million individual page views in the past years. And currently he serves as the president of the International Headache Society. Before we go ahead, disclaimer, this is not a medical podcast. All topics discussed in this podcast are for informational purposes only. If you suffer from cluster headaches or from any pain, you should contact your nearest healthcare provider. Having said that, welcome, Dr. Perez. Very happy to have you. Anything I missed out on the introduction?
Thank you, Darshan, for your nice introduction. It's a real pleasure to be here. I'm very happy to talk about headaches and cluster headaches and all related issues. Thanks for inviting.
It's a pleasure to have you here. It's always a bit, it's interesting, a bit also fascinating to me when I see that you've dedicated 25 years of research and 25 plus years to headache medicine. And as a sufferer, I've had this for 9+ years now, and I can imagine what the state of the world, what the state of headaches and our understanding of it and research was when you started out. What originally drew you into this field, and how did cluster headache specifically become one of your focus areas?
Yeah, very nice question. Well, first, neurology is so fascinating, and I had the opportunity and the honor to have good mentors, very well knowledge in the headache field, and also became, since medical school, interested in the topic. Cluster headache is also fascinating because, the aspects and also by the severity of disease. It's amazing how much one individual can suffer by the attacks, not to diminish the importance of the other headaches, migraine, tension type. But cluster headache has its own, individual aspect and very consistent and solid disease where we can help a lot. We really, and that's the other part. I mean, we have so many things to do, and this is one of the most, you know, nice diseases to treat because the response is good. As always, in all fields of medicines, there are more refractory patients, but in general, the confidence for good treatments and results in cluster headache is really good. It's really great.
Okay, and of course, you treat patients as well. So, how have you seen the treatment landscape evolve? How was maybe more particularly to where you practice in Brazil? Yeah, how has it changed from when you started to what it is now?
It it did change um, conceptually and with medication availability. Uh, we are doing more and more for the patients. We have new medications. We have new strategies. There are, new drugs that weren't available in the past. But, we, even with the old medications, we could do a very good job in finishing the cycle and interrupting the attack when it comes. And also one thing that I like is to think about preventing the next bout.
Mhm.
Something that is not common sense for all physicians in the field. But I truly believe that, we have to treat cluster headache as a chronic disease. And if you come and go with bouts, we should, do something for the next one that is probably going to occur. So, and not just wait until it comes and then we treat it. So that's something that I think, you know,
That's that's interesting. Could you maybe elaborate on that? So, as an episodic, I think I have, like, personally, I'm intrigued by this. I'm currently in remission, and I think I'm following certain things like keeping a strict sleeping regimen. I think that has the biggest effect, which is also something under my control, but some things, like especially in the Netherlands, because of the rate of change of the daylight of the season, some things are not. So while in remission, what do you, for example, suggest or advise your patients to do?
yeah. So I think what we should do always is to customize the patient and individualize diagnosis and the treatment plan. So in general, the diagnosis is kind of easy. I mean, when you have the disease and when you read the description, you go like, that's that's not difficult. But every patient will have its own particularities and comorbidities. So one thing we have to understand is whether the pain system is doing what it's supposed to do, meaning that the pain is secondary to another aspect.
Mhm.
The first thing is, is this a secondary cluster headache or is it primary? Or maybe we have trigger factors. We have some part of the disease that is secondary to specific aspects, internal or external, environmental. But, what are, where is the dysfunction of the pain system coming from? Is it just, particular inner state, or is this a group of comorbidities? So we have to study, for instance, sleep apnea or sleep habits, mental health, and, nasal sinuses, structures, medications. So um, there is the circulation. There is a group of diseases that, and when you target specific aspects of the patient, then you may be more specific in terms of treatment. But in general, I think, it is nice I like to see patients out of the bout. So And this is a bias that occurs everywhere. So you always see patients when they are, in,
There
in,
was
in in their burnouts or in their worst periods, and you tend not to see them when they're good and when they're okay. It's important to see when they're okay because then you have a better understanding of the baseline.
Mhm.
Then you can talk about long-term modifications. So if we want to, and often we need to just, take patients out of the bout and improve their quality of life immediately. But I think we should, understand people's life history, cultural aspects, biological aspects, and then, you know, make a better, a better relationship with internal and the external world, and make patients and people more balanced in their lives. And I think this is going to help anybody's health conditions, but particularly cluster headache, I think, is also important. So the evidence, the studies are not that great for guidance in terms of the secondary prevention, the prevention of the next bout, because, you may have years between the bouts. But I don't think that's an excuse, because we have models like multiple sclerosis is also a bout in remitting.
Is it okay?
Yeah. So in everything in MS, or, the basis of MS treatment, even though you have acute treatments, is prevention of the next bout. And MS is not invisible because you have lesions in the brain, you have no dysfunction. And even though the cluster headache attack is pictoric and is hard to watch, it is still an invisible disease.
Okay.
So, but the disability is major, is we may calculate it, and it could be even higher than MS. So we have to think, I like the model of treating MS and understanding, like, if we, let's say you have, in 10 years, you're going to have 3 bouts, for instance. If you do something that you reduce to 3 to 2 or to 1, then, it's good. Ideally, you don't have, you don't want to have any bout in the future, right? But the methodology of studies in MS is to reduce the chances to have a next bout.
Mhm.
So I think we have to move the science and the treatment of cluster headache into this more chronic and long-term view of the disease.
Absolutely. And I think I can relate to a few parts. I think, especially when I was having frequent bouts, and if it was verapamil, for instance, it would be very long after the bout, or sometimes I would not stop it. Now, I'm not saying that was the right way to do it, but I think two things that you mentioned that I could resonate with there. I think one is the quality of life, right? As sufferers, we do have anxiety and depression. Every twinge in the head, you're like, is that an attack? Is that my cycle starting? I still
Yeah.
have, when I usually pack my triptans everywhere I go, but in case I forget sometimes, which happens. And then I think I was at the dentist last week, and then I had to go in a hurry, and then the lights came on, the bright lights, and then I didn't pack my triptan. And then suddenly it was like half an hour, nothing. I didn't get an attack, but it was just anguish. Do you see that? How do you deal with that when you see patients?
No, it's a big thing. I mean, the anticipatory anxiety. I mean, everything that you experience that is not good, you are afraid of having again, anything. And of course, by having clusters and clusters, you you were vigilant, hyper vigilant of, anything that could trigger. And so anxiety is a big thing. And also, the disease may put you in a state, right, that you are more vulnerable in terms of, other conditions. And we've seen this in populational studies, even in genetic studies. There is a correlation for, use of substances for ADHD, for instance, mood disorders, and anxiety is a big thing.
Do you recommend to your patients also to see a psychologist, psychiatrist to get therapy perhaps? Is there some case to be made for an integrated treatment approach for cluster headaches?
Well, of course, psychotherapy is welcome for everybody,
Mhm.
for every people. It is, in the acute treatment, it's hard to start something, and it's hard to deal with something that is bothering you so much and interfering with your agenda so much. But not only psychotherapy, or not only the mental health evaluation, but general life. I mean, I like to look at my patients' general health, you know, obesity, cholesterol levels, cardiovascular risk, everything. And, it, you sometimes I, of course, refer to psychiatrists or to psychologists, but I like to do my personal mental health assessment of my patients. Sometimes when you have to do with particular aspects that need subspecialists in psychiatry, like those that need the substance use aspects. Those are the more severe patients. I work in the psychiatry department here at the University of São Paulo. So I receive patients from the psychiatrists that they're taking care and then they need when they have headaches. So I'm kind of a little biased because of that. But in general, you're definitely right. I mean, the approach of mental health, general health, lifestyle, I think is crucial for the good results.
Yeah, and I can also, like having been through many of these cases myself. The other thing that stood out to me is the treatment in in between bouts. Now, it is very important, and I think like some of the things I've tried, for example, are going to like a sleep coach that you mentioned, but definitely this varies for certain people on how they deal with it. When you're in between bouts, you don't want to think about cluster headaches. You don't want to think about the pain. You want to live a normal life. To someone that may think that, I'm not in pain right now, I want to forget about it. How would you talk to them to have an appointment, or how would you reason with them to still continue, the off bout management, let's call it?
Yeah, no, you're touching a very important and sensitive topic. Uh, yes, there is this pattern of, oh, what a terrible, bout I had, and I just want to forget. But think about kidney stones, right? If you have a trend to have acute kidney stones attacks, if you don't do anything, right, you have to, you're going to have maybe another. And when I ask my patients, Darshan, about whether if you would do something in terms of avoiding the next bout,
Mhm.
I never heard anything different from, yes, I will do something. Of course, people's agenda and when they're okay, it's a natural trend, when people are doing well, they don't go to
Mhm.
the doctor, the, the male predominance of cluster headache, even though that is changing, but the male predominance also, men are less careful with their diseases than women. So that's another thing. But yeah, adherence is a big issue in medicine overall. But so first I ask, I bring the concept to
Mhm.
the patient, and I use some other models like, kidney stones or the model of cholesterol lowering. So why we take medications for cholesterol? Oh, it is for decreased cholesterol levels. And so what is the main reason? The main reason is to decrease the chances of having a myocardial infarction or a stroke in years, right? And you may have high risk, but let's give an example of someone with 6% chance of having a stroke or MI in 10 years. And then you give a cholesterol medication, and then you decrease the 6 to 4% or 3%. It's just an example. So you take the medication for 10 years in order to decrease the percentage, the chances to have one attack. So why we'll do that for cluster headache? To give some medications to decrease the chance of having an attack. So it's not new to medicine. It's prevention. Why we haven't touched that yet? Because there is this feeling of abandonment. So like, let's move the page and let's forget about it.
Like a traumatic event almost. You want
Yeah.
to
And also, I think the physicians, our field is not, looking at this in this framework. So, and then the studies are difficult to do because cluster headache is a more rare condition. So you don't do a trial like this. Recruitment is difficult. The long term of the studies that you have, so you have to study this group for years, So in MS, it's okay. The studies will last 5 years or so. But we are used to do trials like with the 2-hour range for migraine or the 3 months range for migraine prevention. And then you come up with something that you're going to have to do for 3 or 4 years or 5 years. So it's challenging, but I think is the right way to go.
And I think that's a good segue towards research. Of course, that's such a crucial part of your career as well. You've, of course, studied, practiced in the Brazil and the US and have co-authored papers with researchers all over the world, I bet. Like, what have you noticed has gone well with cluster headache research in the recent years, let's say in the last 10 to 15 years? And what are the other challenges you see? You just mentioned the longitudinal nature of studies and recruitment of patients. So what's gone well? What more could be done? How do we do it?
Well, I think it's definitely going well. I think it's improving. But if you compare how much investment, how much money for research, for headaches in general, is a lot less than MS or any other neurological disease that is more visible. So the work is to make cluster headache and the other headaches more visible, right? So people understand what it is, people measure it and address in the right way. So we need a lot more, and we could improve a lot more, even though what has been achieved so far is good progress. But it's, I think the change we'll make by having more investment and having more visibility to disease is a lot more than what we have so far. And so, yeah, yeah, I hope in the future we have more visibility. We are doing some projects to reduce that. First is to frame cluster headache as a rare disease. Chronic cluster headache is definitely a rare disease, and there's been just a paper out showing that. But cluster headache in general, in some countries, can be classified as a rare disease. And when you have a rare disease, you have all sorts of benefits in terms of access, in terms of, regulatory aspects of new medications and trials and all that. So I think is a way to fit or to, take advantage of this pathway that is there that we never thought about. Second is to make cluster headache part of the global burden of disease monitoring. So the global burden of disease is what tells us number of suffering from diseases
Mhm.
in the planet. So it's a measurement of all sorts of diseases, all categories. And we have two headache disorders there. So first we have neonatal injuries, and we have the chronic disease, and then the chronics will subdivide into cardio, cancer, gastro, and neurological. Then neurological will divide into headaches, Parkinson's, Alzheimer's, MS, and all those. And then fourth layer in headaches disorders, we have migraine and tension type. And we are working to add cluster headache as the third,
Mhm.
uh, which is, something that requires some effort. But as soon as it goes, I think the visibility will definitely improve. And also a good news that recently the WHO provided cluster headache medications as rapamune and sumatriptan subcutaneous as part of the essential medicine list. So it's the list of medications that all countries have to have in order to provide healthcare to people. So that was recently included, and I think is a big and important gain that we have to spread this word, and also the society is working in providing and helping healthcare policymakers in order to, they don't know what to do with that. So they have a disorder and a list of medications. So how to handle, how to, diagnose, how to, deliver the care to the people who need it.
Understood. Will it also potentially in, let's say, in a part of the world where this isn't approved by an insurance provider or something, would getting listed on the WHO list also help a doctor make a case for it, advocate for verapamil and sumatriptans as approved treatments for cluster headaches?
Yeah, there are several aspects of regulatory, issues, and each country, each region has its own environment. But certainly, after those medications included in the essential medication list, it will definitely help in terms of, not only the public system to provide those medications and care, but also the private system. So it would depend heavily on each country's
Mhm.
policy and medical care and coverage and all that. But the idea is to target all those countries, regions in order to move this initiative forward.
I'm sure IHS had a big part to play in this development. That's good news indeed. So for someone that is listening that doesn't know about the International Headache Society, can you tell us more about the society? What are some of the activities that the society does?
Yeah, the International Headache Society is the host of the classification for headache disorders of the Journal of Cephalology. It's a society that is intended to advance science education and to help decrease the burden of those who suffer from headache disorders. So we we have members from all parts of the world. We have national headache societies, now more than 60, around 65. We have presence, you know, we have global presence and a very good capillarity. So there are headache specialists. So people trained in general neurologists
Mhm.
that train in headache, that is a subspecialty. But also there is in many countries, care can be done and delivered by general neurologists or general practitioners or other specialties. For instance, cluster headache patients may go to ENT first because they think they have
Yeah.
sinus disease, or to the
Uh, Of
or
the
the, to the emergency room. So those places and specialists are also targets for us to, make the disorder more visible and the education programs toward, understanding and getting those sufferers better care.
And you have special interest groups as well, I think, in which cluster headache has a special interest group. And earlier you were also mentioning about the mapping of the disease and the documentation. Can you tell us more about that?
Yeah, so we have studies about epidemiology, how many people suffer, but there is a need for more studies. So it's also a program that is in planning. And there are also ideas of registries where we, have information about patients. And there are registries already, but the more information we have and more research we do, is more likely that we provide new discoveries and new treatments and improve people's quality of life.
And from a global population level, what are some of the things or insights that you think could benefit this mapping, or what would be interesting at worst, insightful at best for you?
Well, I think advocacy and awareness campaigns are very important. I think tools like the MyClusters that you run is very important as well. So people have a special place where they can communicate with physicians or report their attacks, track their attacks, and get insights from that. So this is also, and the technology is improving. AI and big data, merging genetic data with behavioral, with environmental. We are in the era of
Yeah.
scratching the surface of big data sets, studies.
Yeah, I think especially for diseases that don't have biomarkers, and you have to, like, one, it's not like diabetes where you could, have a hardware to measure blood glucose, and that gives a lot of insights. Second, given the circadian nature of cluster headaches, I think then it's still like the whole in and out of bouts and remission. It's just like, even as I am personally invested in it, of course, but even otherwise, it's just very, like, it's like I feel, like, almost want to feel like an investigator almost, like, how is this happening? How is this that, like, my last cycle happened across 3 continents. I was in India and the Netherlands, and then 3 countries, sorry, and then the UK as well. And like, nothing changed. And then suddenly one day it was done. And then the next day I feel better. So it's just that I know it doesn't happen at the same time, but it happens for most of us. It happens like that the bout just comes out of nowhere, and then you have intense pain, and then you go out of bouts. But anyway, that's, yeah, it's interesting as well. Like, that's what got me into, like, this, what drives me with my clusters. But going back to IHS and your role as the president, what are your priorities, or what would your, like, any ideal outcomes or any goals or any focus areas you have as your presidency continues?
We've been focusing 3 layers. IHS has a long history of commitment with science, education, and awareness. My personal touch is, trying to bring more equity to publications and to access to medication. I think, cluster headache is also a priority. So I'm very glad that, things are moving and we are succeeding in improving this. I'm also interested in studying and bringing what we coined the transcultural headache medicine project, where we try to understand the boundaries and how culture, beliefs, language, even migration can shape healthcare and health outcomes. So starting with, for instance, traditional medicines,
Yeah.
how they how they see migraine and cluster headaches. The systems are different. The diagnostic frameworks, the way you ask questions to patients, the way you examine, like traditional Chinese medicine looks at the tongue, the pulse in a different way, and classify diseases in different systems. So how does merge into what we know
Because
about your
what they attribute also to the cause or the mechanism of the disease as well, I can imagine.
exactly. So there are several different explanatory models. So
Right.
why we have a certain illness, and based on the traditional medicine or popular or culture, you're gonna get different models, explanatory models. So people will, so you have to frame your speech and in your explanation into the cultural background of the patient. So, and there is a very important topic in medicine and in healthcare, that is the cultural competence. So one healthcare provider is supposed to understand people's culture and provide a better care by, customizing it to individuals' culture. So we have to understand what people do, and
Mm.
uh, it's not like, a vertical relation where modern medicine is right and everything else is wrong, but rather, understanding that in many countries we live a plural healthcare where things are occurring simultaneously. And even if it's not plural, people are taking and use their resources that are cultural and sometimes religious, sometimes based on traditional medicines that they will do anyway.
Yeah, be even with supplements, for example, right? Like the vitamin D3 regimen is quite popular, and it sort of, as you're saying this, I'm thinking maybe in some cultures they have, foods rich in magnesium, foods rich in vitamins, and like increasing melatonin that are now with supplements, of course, but potentially is that in the range of like what you're looking
Yeah.
at?
Yes. So we like to map extensively therapies that people use,
Hmm.
and we divide it into herbal, physical, and mental therapies. And the plan is to really map what what we have, and then understand the biological plausibility and also risks and also safety,
Hmm.
effectiveness, and measure in terms of meta-analysis and studies that has been already done, and map what is in need to be done, right? So maybe there are, not maybe, certainly there are treatments that should go through a regular randomized clinical trial. And
Hmm.
it's difficult in terms of methodology when you have, therapies that are there are multi layers of therapy. So, or multiple plans in some cultures. So it's part of our scope to the therapies to bridge the concepts and even to map misconceptions. Like in Brazil, it's very common that people think that migraines or headaches are coming from the liver. They feel nausea and then they connect to something, and they blame some liver dysfunction that is, I mean, just not true. So yeah, we have accepted the first paper, foundational paper of the transcultural headache medicine idea. And we are now moving into understanding local aspects and also mapping and getting all those layers of understanding to proceed with the project.
Do you think it's also something to do with how different cultures maybe like approach disease in a way as well? Like how are you taught to handle a disease? What is expected of you? I was doing some research for this and I saw you have also studied or done some research on the cephalophobia. I mean, I can't say this word right, but
That
uh,
is right.
so is you think it's part of it? What is this the phobia? What did you observe in the study?
Yeah, cephalophobia is basically afraid of having another headache, which is, maybe parts of having a migraine or a cluster headache or any other chronic headache. So, yeah, and then the anxiety state, the phobic state, sometimes is so big that interferes with actually, promoting an attack.
Okay,
Yeah, it is also
it's a vicious cycle.
is a vicious cycle, definitely. And sometimes, you go like, a spiral of reinforcements. And yeah, it's a model. It's also another explanatory model. And it might be rooted in cultural aspects. Some cultures tend to be more resilient. Some cultures tend to be more prone to
Mhm.
anticipation and all that. So, and also that has to do with the history of the population and country. And, it's a very interesting topic, very important to study.
And I suppose it's understanding as well, right? Like as you're saying this, I can completely understand, but let's, I mean, it is also quite known that there is a bit of an awareness issue with cluster headaches, and the headaches are co-opted by everyone because, like healthy people also sometimes get headaches to maybe to a supporter, to a family member, to someone that is not aware of cluster headaches or headache disorders. How can you like explain it to them that, like this fear is true? That especially if you had cluster headaches for a few years, that whether you're in a cycle or about to start a cycle, the fear is true, the anxiety is true, it's justified.
Yeah, exactly. So the explanation is that, you know, human perception is only in one time frame, is just now, right? We all live in this very second, but we can anticipate things. So you know what you're going to do tomorrow or this afternoon, and you remember what you have done. So we have memory of the past and we have the projection of the future, but the perception is always right now.
Mhm.
So this very second. So if you anticipate too much, right? If you pollute your mind with negative thoughts or what we call catastrophization, your cells, your mind, your body, your brain will interpret that that threat is occurring right now, and
Mhm.
you have to fight or flight right now. And then that's why then your defense mechanisms are on. So in pain as a defense mechanism will make we'll have to be on, and we'll have
Got
to admit you that you are in a threat condition. So it is important for people to understand that mechanism and try to control, but also we understand that this is a trait, that this is a trend, that this is something that is it did not started with the cell phones and social media. It started, you know, thousands of years when the human mankind and even the mammifers were in development. So
it.
it's like very, very old and very rooted in keeping you alive. So those things are, and then we may have a natural trend to be more likely to trigger those components in our system.
And to someone, let's say this is on the other spectrum, to someone, if you tell them, yeah, you have cluster headaches, and then they say, oh, take a paracetamol or drink some water. How does one explain cluster headaches to these people? Given, okay, let's like, if it's me, I get angry first and then I think about it. But
Yeah. So it's not an easy task because again, everything that you don't have a number or you don't have an image is hard for people to understand.
Mhm.
And so all mental health, all pain, all subjective symptoms and diseases based in symptoms, it's all based in perception. And so it's always hard to tell people what you're feeling. Even, the color you see, you may see green in a different way that someone else is seeing green. So, and pain is the same thing. Headache is common in the population. So maybe, between two-thirds and 90% of people will have some headache experience in the past year. But you have a small or not that small percentage of people, let's say 10-15% of people of the population that suffers from a disorder. So you have 80-90% of people that have trivial experience of headache, and you have 10% of people with suffering, as a disease. So, that's why people go back to you and say, take some paracetamol or rest. It's just, I've had a headache, so I know what it is. But you see the difference, the experience is common. And so people kind of, don't take it serious. But it is also a matter of education. And now with video platforms and social media and, communication is so much better now that the scene is changing. So people know more about it and understand. And also mental health is like moving from one thing that was so obscure and, immaterial and to something that is really, is real and is like
absolutely, I think
brain. And the
awareness
pain conditions
also,
are going in the same way, I think.
and awareness, I think, is key. I think everything starts with awareness. And I realize we're running out of time. There's like a couple of quick questions and then I'll let you go, I swear. Talking about, social media awareness, it's also a couple of weeks away from Cluster Headache Awareness Day. Do you have a message for our listeners, in light of Awareness Day, or what can we do, including posting on social media or sharing their stories? How can our listeners, like, where can they find awareness, facts, etc., and where can they post about this, or where can they disseminate this information, how it helps?
Yeah, I think it's making the suffering visible, is to speak up, is to show up, is to, you know, tell the story. We have had the experience here in Brazil with promoting. We do campaigns every year for cluster headache awareness, and I think you've seen a BBC video showing people have the attack, and we thought, oh, this is too much, and let's not do it. It's too aggressive. And then, in one year, we thought, you know what? It was BBC. Um, it's publicly available. Let's let's show how the attack is,
Mm.
and then it went viral
Yeah.
because we felt like we were kind of
Because that's not what people imagine when you say headaches.
when you talk about it is when you describe the headache is one thing. When you see someone having an attack is a total different. And people in social media are attracted or attracted to the algorithm that is causing more. I don't want to make people more anxious and more conditioned to social media, that I think is a real problem. But in terms of, promoting awareness of disease, I think, to communicate with people what is your suffering like is not about, making yourself in a victim position, or making you know, you're not be seen as a fragile person or anything, but, just I'm just sharing the experience that when we shared that video that BBC has done, we had millions of views. It was really striking. And yeah, it's not it's just sharing an experience. It might have to do with what the local experience is, but just for you to know. And then, yeah, promote the campaigns and try to get ambassadors, try to get people that speak to the society and take advantage of channels that are already touching people and trying to get cluster headache into the agenda of diseases. So 21 of March is the date. So, fight for putting the date in the schedule. You see every day has a disease day. You have the color month of,
Yeah.
awareness. And so that's something that
We fight.
we fight for awareness.
And where can our listeners follow you, International Headache Society? Is Instagram the best place to stay aware of developments, news?
Instagram is a good channel. We post very frequently, and is a good place to know also our website and other social media. And we, uh, you know, we're developing our communication strategy every time. We're improving
That's perfect.
more. So it's really nice to have this podcast with you. And, I'm really happy that I'm here and was invited. So hopefully
Yeah, happy.
it will help people out there.
Absolutely. I'll drop the links as well in the show description. So if anyone wants to find the website and the Instagram accounts, International Headache Society. I mean, yeah, you can Google it as well. It'll be the first result that shows, but I'll drop the links anyway. Last question, and I'll let you go. If there was a genie with one wish to make a breakthrough progress in cluster headache research, what would you wish for?
In terms of um, a new medication, or
Yeah, I think new medication. But where do you think the breakthrough can be to get to that new medication, I suppose? Or is there something in the works in trials or something that you're hoping?
Darshan, I think the worst bottleneck is diagnosis, because by the time you diagnose and you start treatment, then it's another level of control. It's much, of course, better control than when you don't know what you have, and that's the big problem. So if I would pick one, I would pick, right and immediate diagnosis and access to treatment. So, of course, new medication, new strategies. We need more acute treatment rather than sumatriptan. We need more preventives. We need to structure the prevention of the next bout. So there are things to improve, but the biggest bottleneck, I think, in burden of disease is, again, awareness.
I think those are excellent themes that you just mentioned, right? Diagnosis, better acute medication, preventive medication, and prevention of next bouts. And yeah, I think those are amazing directions for research and in a good fight to fight, a goal to aim for. And I think a good way to end the show as well. Thank you so much for joining us again. It's a privilege to have you here. Thanks for all the the work that you're doing in advocating and researching and treating cluster headaches and the burden and anxiety. Thank you again, Dr. Perez.
Thank you, Darshan. Thanks for having me. Compliments on your work and your really nice projects, and what you're doing is also great. It's really a big pleasure to be here, and hopefully, and definitely